though I've spent such a long time here, this time it was tough. I'm at Chembur. You're at Kandivli, you said.
Yeah.
Okay. Rita ji, what do you do?
Yes, I'm based in Gurgaon, and we run an organization, a non-profit, in mental health. So we basically work for personal and social recovery of people. We are not a clinical model. People who are living, with predominantly with severe mental illness, like schizophrenia, bipolar disorder, and uh, you know, uh, other severe mental illnesses. So we've been working since 2011 with people, their families, and with communities in general to increase the awareness about mental health and mental health, the importance of mental health as a very important part of health, and also trying to create an acceptance for people with mental health issues in the society. So yeah, that's like
Nice. Oh, there is a lot of requirement for that, as we were seeing this need for holistic health. Wherein,
I know.
yeah. In fact, I think I've heard you before. Do you be are you attached with the USG morning sessions also?
Uh, I used
Sometime
to.
you have, yeah.
Is that was the question to me?
Yes, to you
So
only.
I have attended the morning sessions for quite some time, but about 2 years back. And
Yeah.
last 2 years, I have not really attended the morning sessions. But before that, for
Yeah.
almost a year and a half, I was attending regularly. So,
Yeah, that's why I got your name now. That's why
okay.
just
Yeah,
reminded me of you. Yeah.
yeah.
Nice work, Didi, you're doing at Gurgaon there. So you had shared so many times, so I just recalled.
Yes,
Yeah.
yes.
Yeah.
Yeah.
Nice. I think we are only having 3 minutes to go. Let me see whether. Yeah. Dr. Sharmila ji is also here.
Namaste, Sharmila ji.
Namaste, Didi.
Hello, namaste everyone.
Hi.
Namaste.
Namaste, good to see you.
Likewise.
Good to see Raj Lakshmi ji also again. I'm glad to see that today you're not having any issue in joining, which is very nice.
That was my own doing yesterday. I clicked some button and the audio visual God's blessings are very much needed, I think, more than anything else.
I know.
Nice to see everyone. I think a couple of people were also further expected to join, but perhaps maybe they might be late. I think since it's time, perhaps Aprajita ji, should we start?
Yeah, we can start. So, yeah, welcome everybody to the panel discussion on holistic health. So since the morning since 2 days, in fact, we are discussing a holistic education. And today we were wanting a discussion in which what kind of a vision that we look for holistic health discussed. So now I'll just hand over the session to our moderator, Dr. Sharmila Asthana ji. So I'll briefly introduce her as well. So Dr. Sharmila Asthana, she did her MBBS from Mahatma Gandhi Memorial Medical Hospital in Indore, India, and MD in pediatrics from Regional Children's Hospital of Southern New Jersey, USA. She's worked as an assistant professor also over there in Philadelphia. She has practiced in US before she moved back to India, and now she is full-time. She has devoted her time to understanding universal human values and pursuing holistic approach to health. So, Didi, over to you. Welcome.
So, namaste again, everyone. Thank you, Aparajita ji. It's been a pleasure that, with this forum, we are able to interact with all our esteemed panelists. And I think before we dive into the vision for holistic health, let me just briefly, for those of us who were perhaps not there yesterday, let me just briefly go through the introduction of the panelists and also a brief about the process of the whole panel discussion today. So if I, look at, we have, let me start with Rajalakshmi ji. So Dr. Rajalakshmi Iyer ji, she graduated from Grant Medical College, Mumbai, and specialized in rehab medicine from Madras Medical College, Chennai. She was at AIIMS Rishikesh, where she set up the MD program and also started and headed the Department of Medical Humanities there. Presently, she's on a sabbatical from work to care for her parents. We've had many great insights from her yesterday, and we look forward to hearing from you again today, ma'am. Welcome. We also have with us Dr. Mirunalini, whom we also heard yesterday, and you can see her on your screen. She did her MBBS from Tanjavur Medical College, Tamil Nadu, and MD Anesthesiology from Stanley Medical College, Chennai in Tamil Nadu. She's a certified pain management physician from National Health Education, England. She is currently working as Associate Professor of Anesthesiology in SRM Medical College Hospital and Research Center in Chennai, Tamil Nadu. So, welcome, Mirunalini ji. Glad to have you back. We have Ms. Rita Seth. She is a co-founder of the Sambandh Health Foundation, and she has been working in mental health since 2011. She works for the personal and social recovery of people living with both common and severe mental illness, and has been associated with human values for the past 18 years. So, welcome to you, Rita ji. We'll be glad to hear from you again after a long time. We have Professor Dr. V. Satyanarayanan ji. Namaste.
Didi, are you
Professor
also
Tat-
sharing some slides? Because nothing is there on the screen. I can see, that's why I was asking you.
What is that?
Didi,
Are you?
I will share the slides in some time. I thought
Okay,
we'll
Didi.
do the introductions first.
Yeah,
Then I
Didi,
will
your video also is not on, so I was just thinking.
Video is
Yeah.
not showing.
Yeah, Didi,
no, it's
video
showing,
is
it's
not
showing,
It's on.
it's showing, it's
We can
on,
see
it is
you.
showing.
So, okay, it
It
must
is
be a
visible.
problem at my end. Okay, thank you.
Yeah, just check.
Thank you, Didi. Sorry for
Okay.
interruption. Ji.
That's okay. So Professor Satyanarayanan ji did his MBBS from Stanley Medical College and his MD in pharmacology from Madras Medical College, Chennai. He has almost 30 years of teaching experience and is also active in the clinical and research areas. He is currently working as Associate Dean, Student Affairs, and Professor of Pharmacology in SRM Medical College, Hospital, and Research Center of SRM, and is also serving as chairperson of UHV committee for that institution. So welcome again, Dr. Satyanarayanan ji. Nice to have you with us. So let me, for those who have joined new, Rita ji and Satyanarayanan ji, very briefly, I'll just go through the process of the panel discussion, and then we'll just dive into the vision for holistic health. So what will happen is that I will just give a brief presentation of the what health would look like, a vision for a holistic view of health based on the human values. And with that, I will also be, once I have put that forward, we will have a discussion over it. Now, how it will proceed is that I will be putting forward some questions regarding your views on what was said. And we will all have approximately a maximum of 3 minutes to respond. There is a timer that will become visible on your screen, and you might hear, once the 3 minutes are up, you might hear a small piece of music, which is an indicator that the time is up. So we'll try to, I think many of us are not there today, so we should have sufficient time for 2 to 3 rounds, after which we'll open the discussion for the delegates to ask their questions. And after that, we conclude the session. So let me just go ahead and share my slides. I hope this screen for a vision for a value-based holistic perspective on health is visible to us.
Ji, Didi, it is visible.
Okay, nice. So if I may, yesterday we discussed a little bit about the need for holistic health. We talked of the various achievements of health today, but also raised some of the concerns that we all are seeing in health today. For example, one concern was stress and mental health are not adequately addressed. Focus is more on disease. There seem to be some lack of values in health professionals. So we find that the feeling for patients is lacking. Also, our perspective is in isolation from the whole. And with all of this, healthcare is also becoming increasingly inaccessible for the common man. It's a very high financial burden on society and is leading to a state where it's not likely to be sustainable for long. So with that was the question that, is there a need for a holistic perspective on health? And if I recall our responses yesterday, for the most part, practically unanimously, we all felt that there is a need for a holistic perspective on health. Dr. Rajalakshmi had put it very beautifully that the need for a holistic perspective on health is the elephant in the room, that we all know that the need is there, but we don't want to talk about it. We are, I guess, overwhelmed with it, or, don't want to have to change. So I think the challenge that came up yesterday was how we are going to, there is a need, there was no doubt about that, but how do we go about it? So one viewpoint that I'd like to put before you today, and perhaps we can discuss this in some depth later today. So if we look at physical health today, like we discussed, the approach, whether it's adequate or inadequate, we can see. But the focus seems to be more on getting rid of the disease. So we focus on the medicine, we focus on the treatment and so on, machines and those kind of things. And whether we are problem solving or we are providing more of symptom relief, in a sense, symptom suppression. So if we look at this, then we might find that we are largely focusing on symptom suppression or symptom relief. So whether we can have, whether we can have a shift in this paradigm and move from symptom suppression to treating the root cause. That could be one shift that we may want to see. Another shift could be moving from disease to health. So if we look at the proposal, which is on the right side of the screen that you see, the proposal for physical health, the program for physical health could be a program for staying healthy rather than for focus being largely on getting rid of the disease. We could focus on the intake, the lifestyle, labor and exercise, postures for regulating the internal and external body organs, one example of which is yoga, which is coming from our tradition. Regulated breathing, another example from our tradition in terms of pranayam. So this is a proposal for a program. There could be other similar programs, but something that is all inclusive. And the question that we can ask ourselves is, should health education and healthcare be focusing on all of these aspects, 1, 2, 3, and 4? Or should we largely be limiting it to 4? So that is when it comes to physical health. Now, if we look at how we perceive the human being, so perhaps we are perceiving the human being as a body, where the brain is in charge of the body and it is responsible for all the parts of the body and their functioning. We talk of the brain releasing endorphins, hormones, and then governing all the things that happen in the body. But the problem with this approach is that it leaves several questions unanswered. What about psychosomatic diseases? What about conditions like the phantom limb? For those of us who are not from the medical background, phantom limb is a condition where you can think of, if a person goes through an amputation, say of a leg, despite the amputation, the person seems to continue to have, say, sensations of itching, pain, and so on in that part which has been amputated. Now, if we see the brain as being in charge, then now there are no nerves connecting to that part. And how does the person still seem to have these sensations? So somewhere there is an assumption in that person that that part is still there, or a non-acceptance of the amputated part. Now, if for this kind of a thing, how do we explain it with the brain? So some things don't match up. Even for psychosomatic diseases, like we have essential hypertension, essentially we don't know the reason for the hypertension. Diabetes, arthritis, SLE, cancers, all sorts of autoimmune disorders. What we are actually dealing with, or why the autoimmune disorders, that's seemingly not very clear. So can we have a paradigm shift from here, moving from a body-centric approach to a mind and body approach, if you will? So on the right side is the proposal that the human being is not just this body, but it is a consciousness or the self of which mind is a part, and the body. And in this, the self is the one that is playing the key role. It is central. It is instructing the body through the brain, and the brain is also a part of the body. Many of us in the Eastern traditions have grown up with these ideas in our traditional texts, but somehow we have gotten disconnected from these thoughts in some ways in modern medicine. There is an example of some people who have been doing a lot of work in this. I'm sure there are many, many examples. One thing that caught my attention was about Dr. Pim van Lommel, a cardiologist from Netherlands, who has done a lot of research in near-death experiences. Being a cardiologist, when he came across people with cardiac arrest, he was looking at, after they have been declared dead, there is brain death. These people who happen to sort of have this near-death experience and then come back. And he was amazed that how with so much clarity they could relate to all the things that were happening at the bedside, the doctors talking, the family members, their conversations. They had a very vivid recall despite the declaration of brain death. So he got curious as to how this was happening and how, if the brain is in charge, once the brain was dead, how could they relate to all this? So his research has been on consciousness beyond death. So the root cause of diseases is understood easily when we address the self. And then we can tackle these diseases more efficiently. So somewhere I would like to say that perhaps we need to have more research in the area of consciousness. And this may help us deal more efficiently and adequately with mental disorders also. For an example, the lay perspective on stress may be that stress is outside. There are stressful situations, people stress us out. And so we try to avoid such situations and people, activities, or we involve ourselves in other activities to bust stress. But what is really stress? Is it outside or is it within? So when we have bad weather, is the problem the weather or in our approach towards it? So if we see ourselves as distinct from the body, we can calmly respond, take responsibility, dress appropriately. But if we see ourselves as the body, we may be fearful of the outcome of the weather on what we think of as ourself, not the body. And with all that fear and anxiety, we overdress. Similarly, when we are in harmony, we are comfortable within, we respond to persons, activities, situations outside. But when we are in disharmony, unhappy, or stressed within, we tend to react to these same people, situations, and activities outside. So if I have to ask you, when does a mother beat her child? When she is comfortable or uncomfortable within? I think the answer will be very clear. So if we look at the human being as body, then people don't seem to understand themselves as who they are as human beings. They don't understand the cause of many of the diseases. There is a fear that something untoward may happen in the body anytime. So we have to rely on doctors, lab tests, and so on for a total dependence on healthcare. They may not rightly utilize their body. But if we have this understanding that human being is the consciousness and the body, the two together, then we can take responsibility for the body to nurture it, to protect it, to rightly utilize it, and health in the body becomes a natural outcome. Yesterday, I spoke of the morning sessions where some outcomes were very encouraging. Perhaps I will discuss it later in the session. And we may have heard some of the sharings in the sharing sessions this morning also. They are very encouraging. People have gotten off hypoglycemics, antidepressants, and so on, just by becoming aware of the self and sort of taking responsibility for the body. So essentially, consciousness and material, these are two distinct units whose needs are different. And fulfillment of these needs is different. So the need of the self is for happiness, which is fulfilled by right understanding and right feeling. And as a part of the right feeling is the feeling of self-regulation. And this leads to health in the body as a natural outcome. So we need to shift focus to consciousness for keeping the body healthy. This is one proposal that we can look at. And further, is the human being an isolated entity or a part of a larger whole? So if we look at the human being as an isolated entity, we don't have clarity about our relationships with other human beings and our environment. This lack of sense of relationship with other human beings leads to fear in the society, lack of concern for nature, and attempts at dominating over nature. And all of these lead to ill health, both mental and physical. So I think a fourth shift in paradigm could be moving from seeing ourselves in isolation to understanding that we are a part of a larger whole, where a human being is a part of a family, a member of society, and a unit embedded in nature. So understanding all of this can help bring about some of the changes that we may be wanting to see. And the feeling of relationships would be a more natural thing that could happen. The outcome could be a healthy self, a self in harmony, or a happy self. Harmony of that self with the body, leading to a healthy body, and the human being in harmony with the environment, or a healthy environment. Which means the picture could look something like what you see on the right side of the screen, where health of the self is the number one priority. And with that, the program of health to keep the body healthy and the health of the environment. So this is what I wanted to share about today. And now if we may go back to your views, what would you, think of this? So if I may start with Rajalakshmi ji. I know a lot of content I've tried to sort of put in in a small time, but longer discussions can be had in workshops and so on. But just to get a brief idea of your thoughts on some of these statements, could we have your views, Dr. Rajalakshmi?
Yeah, hi. I agree with everything you said completely and unconditionally. The challenge, of course, I can speak for from the medical point of view. Let me speak for the medical students, the residents, and faculty. So I would agree completely with you, Sharmila ji. I think the kind of challenges that these students face, they are all of 18 when they come into medical school. And the kind of challenges they face, they probably had a very comfortable childhood and growing up, and suddenly they are thrown into this extremely competitive world with so much of pressure from peers, from faculty, and also the course content, which can be very, very intimidating. So I agree that it's like, being thrown into the deep end of the pool. And I think what would really help, one of the visions, something like a safe space for these people where they have time to process their emotions. I think students just don't have the
True.
time. And if they have the time, they are frightened to actually address these things or even look into the mirror. So if we could create something like a safe space for them, which is what
Yes.
I think medical humanities can do. So
Yes.
that is one thing that I would really, really like happening. And in this space, I think through creativity or through writing down their experiences or poetry or whatever they feel like doing, I think the most important thing is to first address these emotions and also learn self-regulation. Like Sharmila ji said, I think they ought to understand that self-regulation is a responsibility that they need to take. And
Yes.
I think if we have a mentorship program in place, most medical colleges have a mentoring program in place, but I think they don't work very effectively. But the mentor and the mentee, the medical student, I think could have a dialogue and ventilation, and some of these things could be sorted out. But having said that, these really young children, 17, and then they come out at 22. So they are going to be facing challenges. We have to accept that.
Yes.
But also teach them that, there are ways of addressing this. So that is one very, very important thing that I've learned through my days as faculty. Oh, that's my music, is it? Okay.
That's okay. That's okay. You finish what you were saying.
Okay.
Please.
The other thing that I would like happen is for faculty themselves, for each of us really, to be less demanding from these students. And I think that comes from our own reflection and our own, self-love. So that is the other side of the story. So where we teach students to take responsibility for their emotions and self-regulate. I think equally important it is for faculty members to also reflect and be more compassionate. I think academics standard is non-negotiable. They have to be good. But when it comes to inter and intrapersonal things, I think faculty can be a little more compassionate and be less demanding of them. So these are my initial thoughts. And let's hear what the
Yes.
others have to say.
Very nice, Rajlakshmi ji. I think some of the things that you have said make a lot of sense. The mentor-mentee programs. Many of these children are coming from diverse backgrounds, and the kind of stress that they undergo, I think sometimes as faculty, we may not be aware of. Those who are working with humanities are sensitive to these issues. But I think the majority of the faculty are more concerned with the academics part. And so this gets left out, and these children are sort of there, they have to kind of fend for themselves, which is not a very welcoming environment for them. It's a very harsh kind of environment. So yes, and it's very reassuring when you say that you totally agree with some of these statements. Just a question of how we are going to do it. So first, if we can decide the desirability, then we'll also work on how to go about it, I think. Very nice. Thank you. Before we go further, I think Dr. Tanini has joined us.
Namaste, everyone. So, thank you for the organizing committee for having me for such a very interesting webinar. Yes.
Yes, very nice to have you here with us today. For the others, let me just briefly introduce Dr. Tanini. She's Professor of Pediatrics at Chulalongkorn University, Bangkok, Thailand. She is a trained pediatrician and pediatric endocrinologist from the same university and has done a 2-year fellowship at University of California in San Francisco. Currently, she is the Assistant Dean for Graduate Affairs and a member of the Steering Committee for the School of Global Health at Chulalongkorn University, where she is responsible for developing the global health curriculum. She plays an active role in the development and implementation of humanistic medicine and education in Thailand. So, welcome, Dr. Tanini. We can also see Dr. Akhilesh Shukla has joined. Namaste, Dr. Akhilesh. Glad to see you could
Namaste
make
to
it.
all.
Namaste. Very briefly, I'll introduce Dr. Akhilesh Shukla also. He is an MD and PhD in Ayurveda Samhita. He is also an MSc in Yoga and an MA in Sanskrit. He's got almost 50 published articles and papers in journals of repute. He's also one of the co-authors of the book, A Foundation Course in Holistic Human Health, Its Philosophy and Practice. And currently he's working as an assistant professor in the Department of Samhita and Siddhanta at the All India Institute of Ayurveda in Goa, India. So welcome, Dr. Akhilesh.
Thank you. Thank you so much.
Namaste. So just for the benefit of Dr. Akhilesh and Dr. Tanini, yesterday we discussed regarding the need for holistic human health. And today we went through what could be a possible vision for health. And so I think I will just straight away jump into some more questions regarding our thoughts on some of these views. So one of the things that we discussed in the vision for health was that when it comes to psychosomatic disorders, we don't seem to understand the true root cause. Our focus is largely on the body. And so if we don't really understand the root cause, how are we going to cure the disease? So what do you have to say about having this in medical education, something where we refer to the mind-body connection, because that seems to be a gap in our education system. What are your thoughts on this, Dr. Tanini?
Yes, I think that's really important for everyone. Actually, at the moment, in our Department of Pediatrics, we will actually every medical student will rotate to pediatric rotation on the 4th years. So usually every time that the student rotate to our department, we will conduct the workshop for them, just the basic to introduce about the concept of mindfulness, self-compassion. And actually, we also host this similar workshop for our faculty as well, because of course, I think being is teaching. So you have to, be able to reflect what the status of you at the moment. So I think it's really linked to what Professor Shamila talked on the previous about consciousness. So actually, not only the faculty and the medical student, we now introduce this concept and encourage the practice to our patients as well. So I'm a pediatric endocrinologist, so I'm pretty much take care of young children and adolescents with the diabetes. So it's the chronic disease that really suffering as well. So we now actually we conduct the study to test the outcome of the mindfulness self-compassion intervention. Is the additional add-on intervention to the traditional one, and it's found that the outcome is really promising. That's bring the hemoglobin A1C down, and also the diabetes-related distress. So I think I really believe that this skill is could be practicable and keep gaining better and better, but we have to integrate that into our curriculum. So that's I would like to share for now first. Yeah.
Very nice. Thank you, Dr. Tanini. That brings to mind, I'm also, being a pediatrician, have worked with children. And I recall during my training, there was a child life program where there were social workers supporting children with severe life-threatening illnesses like cancers and so on. And there were some research studies done at the time where two sort of children with cancers in similar stages, they were divided into two groups of children. One set were given just the basic chemotherapy, the drugs, and all of that. And the other set was counseled regarding, their role in getting rid of the disease, where they were sort of making diagrams and charts about how the body is, there are bugs that are sort of creating problem in the body, and how the good cells in their body can fight it off. And so with all of that imagery and the counseling, they found that these children did better in their treatments. So simple things like this draws home that point. And I think possibilities are enormous when we look at this. So thank you for your views on that. If I may come to Dr. Satyanarayanan ji, your thoughts on the mind-body connection.
Yeah, first of all, I thank Dr. Sharmila ji for an interesting and insightful presentation. And mind-body connection is nowadays, it has become very obvious by scientists' experiments. For example, in clinical, when we see patients, the patient has anxiety in the mind. You can see, his physical manifestations like, nausea, palpitation, tremor, and sweating like that. The patient has physical pain, chronic pain. We'll have the psychological component also, like, anxiety, some sort of sleeplessness like that. So mind-body connection is, of course, established. There's one step ahead. We can go for self, being in the self. Then you can, it will be more clear. Consciousness or self, it comes, we can understand more clearly about these things.
Yes.
That's my input.
Very true. Thank you, Dr. Satyanarayanan. And I think the audience, the delegates who are listening in, are very much in agreement. The question that more research should be there in consciousness and its role in the health of the human being, 83% have strongly agreed.
Ah, really? Yeah.
So I think we are all kind of saying the same kind of things.
Yes, yes.
And so somewhere it must be right.
Really, yeah.
Yeah. Let's get Dr. Akhilesh's views on this. He is from the background where this is something that is a given, I guess, in the work that he does. Dr. Akhilesh, are
Yes,
you
madam.
with us?
Yeah, yes, madam. Yes, madam.
Yes, please.
So,
Your thoughts on this mind-body connection, even though
yes,
you
yes.
are dealing with it every day.
Yeah.
Yes.
Yes, madam. This is true that the Ayurveda has a lot of information about the holistic view of understanding the health. But actually, what was emphasized here is that it is missing the proper training, is missing in our curriculum. So that we also felt, we also feel here. Actually, recently we conducted survey in our hospital from the patients who are visiting to our hospital, whether they are completely satisfied with the consultation with their doctor, and they are able to share their all spiritual view, their all psychological things to the doctor, or they are just going and saying that I have headache and doctor is giving some medicine for the headache, but he is not concentrating more on the other part. What is the ferment? What are the other things which is causing the headache? So many of the patients, they reveal that they are not able to share the complete thing what they want to share with their doctor, or they are hesitating to share their spiritual aspect, their other family environment, and other things. So this is what I feel is we are becoming more and more technology oriented, and when the patient comes, we just think about what kind of disturbance happened in the biological parameters, and we are just prescribing the pills, maybe because of the huge number of patients and maybe the lack of the time. But this is what actually becoming this is what the scenario we see. And the other thing is, though we have a lot of the things in Ayurveda also about the spiritual care, or we say the sattva vajaya, or the psychological care of the patient, but the proper training is missing. The proper way to train the patient, to train the doctors, budding doctors, how you have to take care the psychological things, spiritual care of the patients, that spiritual health, that is a bit missing. So that is actually required, I feel.
Yes. Very nice. In fact, you would have liked to hear, we had Dr. Saroj Jaisinghe from Sri Lanka yesterday, and he was talking about these, regarding openness about religious backgrounds, the practices, the traditional wisdom. He was also talking about how we, when in our approach in modern medicine today, in our reductionist approach, how we tend to go for molecular causes of disease, which are not necessarily only in the molecules part. So, meaning the consciousness needs to be brought in, which I think it is time now to question that. So, thank you, Dr. Akhilesh, for your views. So, do you think it is time to address the role of the self in the health and ill health of human beings on a priority basis? I mean, if we do this, if we can address the role of the self on a priority basis, maybe I can ask Dr. Rajalakshmi, do you think it could have an impact on how we look at healthcare? Of course, that might change tremendously, but also, do you see anything in terms of the financial burden on society being reduced through this? Dr. Rajalakshmi?
I think I'm not so sure about the financial burden. I think one thing we really need to concentrate on is the public health available in India. The government medical colleges and the government run hospitals and OPDs. I mean, why are we not talking about them? They give excellent care and is available to everybody really, except that of course it's a day where the wages are lost. They have to spend days and that day wage is lost. But can we also think about the government OPDs and the government hospitals? And in our minds, not just think about private hospitals
Yes.
and private practitioners,
Yes.
really. So I would strongly vote for people to go to government hospitals and government-run OPDs. Perhaps that will automatically change or improve the quality also of these places. I don't know what the other panelists, I mean, we could discuss this. So that is the health burden, the financial burden. I think let's ask the others what they think.
Yes. I think one concern yesterday that was brought up regarding this by Jalani ji was regarding the attitude part, the rudeness of the medical faculty and so on. But I think that would be variable, and I think it also starts from our own attitudes in some ways. So the two might be linked, but I think we can ask the others. Dr. Mirunalini, would you like to respond to that? The question is that when we are thinking of cutting the burden of financial burden of disease, should we be thinking more in terms of the government hospitals, the village, link up?
Yes, the government hospitals and the hospitals in rural setups. Like in India, we have primary healthcare centers and urban healthcare centers, which are addressing the needs of people free of cost. But when it comes to the high-end treatments, these centers are there, which are providing free of cost treatments, but only to certain of basic diseases. But when it comes to certain bypass, especially high-end surgeries, bypass surgeries, minimally invasive surgeries like laparoscopy, people from rural sites still need to come to cities. And government hospitals in cities and in interior parts of the city are still doing it. But still, the entire equipment and the instrument and all their equipment and the instrument and all the state-of-art infrastructures are still available only in most of the cities. So when we look for reducing the financial burden, it is not a thing of, say, infrastructure. So maybe accessibility is one of it, but it is not all about infrastructure, I would say. It is more about the burden of disease itself, which is prevalent in the society. So when we see the burden of disease, I would directly link it to the perspective of health people have on their body, on their disease also. Like now, the perspective is that we all were viewing, or people still are viewing themselves as the body. So whenever they and take their health for granted, so only when they are affected with disease, they are able to see that something is wrong with the body, and they immediately start getting treatment for it, going to hospitals. So this is one reason the diseases are still on the increase, because of lack of awareness that we are all born with some healthy body. Everyone, most of us are blessed with healthy body, and the focus here on an individual level and on the healthcare system and in medical education system is not on the staying healthy part. It is rather on treating the disease part, and the general public and the societal perspective has also been shifted to that, treating the disease. So that is forming a cycle, like the burden of disease is increasing and the cost of treatment is increasing, and it forms a cycle. So maybe when the shift it occurs, the focus shifts to staying healthy, then maybe people become more aware of that wonderful body we are all blessed with, and start taking more responsibility for the body, start nurturing the body, protecting the body, and rightly utilizing the body for its true purpose. Then I think there'll be more health than disease, and that I think is the root solution for curbing this financial problem, about this increasing diseases and financial problems in healthcare. That is my view.
Thank you, Dr. Mirunalini, for your thoughts on this and how the feeling of responsibility towards the body can be one way of reducing the financial burden. Dr. Satyanarayanan, would you like to give your views?
Yes, Ji, yeah. See, the major cost burden of the burden healthcare costs are due to the increasing diseases like psychosomatic diseases like diabetes, hypertension, obesity. All these are lifelong, they give treatment. See, we are treating the symptoms alone. Lifelong treatment is required because we don't treat the root cause of the disease. To find out the root cause of the disease, you have to bring in the self and consciousness, where if you find out the root cause, we can bring in the self, we can go into the responsibility, as Dr. Mirunalini told. The responsibility can be created on the self, because understanding is the faculty of the self, not the body. That understanding comes, then naturally the responsibility towards the body will come. Then of course the nurturing and protection, as well as right utilization of the body, can be done. And also we can make a health program also towards the health, for staying healthy. Intake and routine, labor and exercise, posture and regular, as well as not responding to all these things, you can go for medicine and the treatment. So as Dr. Sharmila ji presented, we can set up the program when we create the responsibility in the self, not in the other ways. So in that way, we can take out the disease completely, so that we can prevent the disease. So the healthcare costs also will decrease. And in fact, one more problem is, because of lifelong treatment for the diseases, we see more adverse effects on the part of the drugs. For example, statistics say 1/4 of the hospital admissions are due to drug adverse effects. So because why it happens? Because the patient is exposed to more number of drugs, lifelong treatment we give for certain diseases. So all these things will increase not only the healthcare costs, but damage the patient and their families, as well as on the society. So to find out solution, the only solution is to find the root cause that can be only identified when you bring in the concept of self or consciousness. Yeah, that's
Thank you, Dr. Satyanarayanan. I am just looking at the fact that somebody from the pharmacology background is talking about
adverse effects, drug interactions and adverse effects.
Adverse effects of drugs. So a very sincere thought to that. Yes. And I think perhaps it doesn't have to be an either or. We can look at the consciousness, and we can also look at involving the village the setup that we already have, because much of the counseling and the work that is being done in terms of the Anganwadis and all the richness of that whole institution, a lot of work is done and lot of focus is there on the intake and those kind of
Lifestyle
lifestyle
modifications.
modifications and those sort of things. Just that perhaps we can have it in a more structured way with extending that program to a larger
Yes.
extent, involving the consciousness.
Yes.
That would be, I think, one possibility also that
Yeah.
we could consider.
What I'm saying is we focus more upon the treatment rather than focusing upon lifestyles as well as intake and daily routine.
Yes,
That part.
yes.
So that can be given more significance rather than going for medicine and treatment.
Okay.
I feel like that. Yeah.
Nice. Thank you. Let me come to Rita Seth. I just wanted to check how much time we have. Unfortunately, I did not keep my watch here. 20 minutes? Okay, so we have sufficient time.
Plenty of time. It's only 3:20.
Okay,
We have
okay. So
until
we have
4.
it. Yes, yes. So there is sufficient time. Let me come to Ms. Rita Seth about her experiences with bringing in the consciousness in mental health care. She has been dealing with mental health patients from a very long time. So what are your views on this? What have you found in your experience when dealing with patients with mental sickness, when you bring in the consciousness?
Yeah. So when I see this from the perspective of mental health, one of the slogans we hear from people who are more self-aware and are living with a severe mental illness, it is that please remember that there's a person in there. Because with other illnesses, this may not be so true, but with mental illness, once a person has a mental illness, they are called patients by everybody. They may be their doctors or they may not be their doctors, but people are addressed as patients. So as if they are universal patients, which means they are being seen only from the perspective of the chemical change in their brain and, the treatment and all those things. And if you see the rehabilitation centers that try and address the needs of people living with severe mental illness, they are called rehabilitation centers, which means basically people need to be rehabilitated back into society. But the opportunities provided are very limited in the sense that during their stay, they are in a locked up facility. And some people might be in the danger of harming themselves or others to begin with, but you cannot have a large population people locked up because of that fear. And therapies definitely help people improve functionality and various other things. But people who are recovering need to be in the community, to interact with the community, to participate into the community, to create a space for themselves into the community. It is not that, I have a mental illness, a space needs to be created for me, but you are the one who's talking to the community and the community doesn't know me. So I think as opposed, I wouldn't say opposed to, but the other perspective of the recovery program that we use is basically that we have an open space where people come in and go out according to their own choice. And we don't try to work with their deficits and symptoms. We try to work with their strengths and their desires and the common human goals. So the first attempt is to establish a relationship of trust and respect with people before we start trying to address the impact of the illness. And that, I think, really helps. So while medication is very necessary, but consciousness is something that cannot be ignored. And once you start working towards the wellness of the person, which means we always try and engage them in things that one needs to do on a day-to-day basis for their own living or for doing jobs or to fulfill various roles either in the families or society. and they're out in the community with us. And when they're more confident, they're out into the community themselves, by themselves, taking their peers along to do various things that helps them build their confidence. So the awareness of the consciousness is, I mean, very much there. And that's why a lot of senior staff all have gone through the UHV workshops, where, I think the main things for them to learn is the the values in human relationships and the meaning of freedom, because that's the other important thing. This whole thing is about taking responsibility. This is what is communicated to people. It is not about being cared for. So compassion is not to take care of people and make them feel that they can't do anything themselves and they need to be in confined spaces and restrictive spaces. It is about letting them know that they can do what they want to do with a little support in the beginning and then independently. So I think addressing consciousness and self-awareness in people is very much part of the work we do, and we see really good results. And because of this, we can work with a whole lot of people, because we don't see people need to, that they need to come to us for a specific period of 2 years or 3 years every day. People come in when they need, they need something. The program has a structure, but people don't have any structure. So they approach us for their needs only. Everybody's needs can't be the same just because, you have a severe mental illness. So I think I would say that lots of people go back to work, people go back to family life, people live independently, and we've seen all these outcomes over the years, and we've worked with about 4,000 people since 2011 and we are able to work with a large number of people because we don't need to work in continuity with every person. If the needs are more at any point of time in their life, they will come back to us. When the needs are not so great and they can manage on their own, they are in the community and doing what they want to do, or in their families, or whatever else. And I think as far as cost is concerned, where mental health is concerned, I feel that yes, we always connect people to government hospitals, to PHCs, and but at the same time we engage the community a lot. And a lot of solutions for people's wellness comes through the communities. So the burden of care on whether it is the state or the health departments is reduced, because once people experience wellness, then they want to stay well. In fact, we've seen once they experience wellness, they go more regularly to the psychiatrists because they want to stay that way. They don't want to get unwell. But of course, every story is different. So that's been our experience of so many years.
Very nice, Rita ji. Lot of insights there. Lot of things you are talking from the grassroots level, since you have been working directly with all these people that you see. And I think the take-home message from what I could get from your conversation was one about treating the person inside, not the patient. Another insight that I got from your conversation was looking at the strengths, not pointing out the limitations, the weakness, restricting the person, but rather giving them the freedom to do the things that they really need to do. And also what you mentioned about trust and respect. So if we start from there, the acceptance is already a given. And with that acceptance, I think the other also feels comfortable to share, will talk, will have that trust in you and want to come back to you for the kind of care you are providing. So hats off to you for the work that you do. Best wishes. Thank you. I am looking at this poll regarding the clarity about the self or consciousness. The question is, it may help to address the root cause of many illnesses, and 88% or so mentioned that they agree with that. So I think somewhere we are again saying the same kind of things, all of us. Looking at how we look at our environment today, should we be looking at the human being in isolation from the whole, or do we need to see the human being as a part of the family, the society, nature, and all of existence? So, do we need to include all these in our perspective of health when we talk of health? Because once we see our relatedness with other human beings and with nature, then compassion towards other human beings will be a natural thing for us. Considering the issues that we have today, a lot of patients, their big peeve about doctors is not so much the skill that they have, but regarding the lack of compassion that they seem to see in people today in the health profession. So could this be one way of looking at it? And let me ask maybe Dr. Akhilesh Shukla, what are your thoughts on this? Seeing ourselves as part of the family, part of the society, a unit of nature.
So actually, we have the concept that the human being is an epitome of this whole existence. So we cannot see ourselves as a isolated being. Actually, we all are linked with everything. All living creature, everything, living, non-living creature are all linked. And our life, our health is depend upon all other life, all other health. If environment is healthy, other things are healthy, then only I will be healthy. If I take myself as a separate one, then it is not possible that I should maintain our health. So when I am able to feel that everything, all other beings are connected with him, not only the human being, but all the living creature, everything is connected, then only I can be healthy. If you take anything, like suppose if you take the example of a food, it is not just I took it from the market and it is on my plate, but where it is cultivated, what kind of things done in the previously, where it is what was the kind of storage done, what kind of other things done, and how it was cooked, how it was processed, and then it came to me. So if I have if I see that the food is in my plate and if I limit to that, then it is not in my control. If all other things are in my hand, then only I can say that I have control on my food. So similarly, all other things, everything is linked. So that way only we can think about the health. Health we cannot see as a, and another thing which Madam Rita said told, that lot of responsibility and lot of solutions comes from the society.
Yes.
So medical system alone cannot be blamed or cannot be make responsible for healthcare of the people. It is our own responsibility of the society, responsibility of each and everyone, including like the from where we get the milk, from where we get the other things, the working atmosphere where I'm working. So everything is connected with my health. And then only I can see as a healthy individual, as a healthy family, as a healthy society, and a healthy universe. So what you told, madam, that we all are connected and we have to have a universal view. That is the true view of seeing the health. Yeah.
May I make a comment and a question?
Please, madam.
I'm sorry, there was a little hiccup here, but I heard a question perhaps from, was it Rajalakshmi ji?
Yes, I had a comment and a question.
Yes, please.
Regarding
question
the relationship. Question to Dr. Akhilesh.
Yes, please. Please go
the
ahead.
comment was that during rounds in my hospital, what I've seen is that, the family is usually sent out of the room. which is a terrible thing to do. And as long as I could, I have tried to ask them to come in rather than, send the family out during rounds. Perhaps the pediatricians always have the parents, so you probably do not have this problem. But when it comes to dealing with adults, usually the nurse sends all the relatives out of the room, and then the door's closed, and then the team takes the rounds. That's what happens in our hospitals, which I think is terrible. And because I deal with rehab medicine, I've tried always to do the reverse, to get the patients by the bedside so that we can discuss together. So my question was to Dr. Akhilesh, how do rounds happen in your hospital? Are the relatives always by the bedside, or do you send them out?
No, madam. Actually, we have the tagline of care with compassion. So this is the tagline of our All India Institute of Ayurveda. And we allow the patient's caregiver to be there when the doctor is taking the round. And actually, even we discuss with, like, whenever the doctor is taking round, we keep one part that we should discuss with the caregiver also, who are accompanying the patients, and explain them everything, what is going on, how much days he will be here, and what kind of result we are expecting. So that all are, because sometimes the patient is ill and he will not be able to take care himself. Then the other supporting members only will be help in success of my treatment. So it is not just the part of sister and medical person, it is part of the caregivers also. So we give importance to the caregivers. So that is there, madam, in our and one thing, like some of they have commented that the doctor, government hospitals then do not provide proper care. So I am completely disagree with this. Actually, we put lot of efforts in providing the best care to our patients in every way, whatever the way it is possible. Even sometimes we are hearing the scolding, sometimes we are hearing some this also from the patients and the caregivers, but we have learned to keep quiet and do our job. So that is the way we are doing, madam. We have almost 800 footfalls every day, but still we are able to manage, and or all staff, security person, everyone, they are very well behaved with the patients, madam. I think this is the part of our treatment also, to take care of the caregivers.
Nice.
Yeah, and can I also add the point, Dr. Shamila
Yes,
talked
yes, please,
about.
Dr. Tanini, please
Yeah,
go
so
ahead.
I would think that at the moment our faculty now revise the curriculum to integrate the concept of One Health into our medical students, because I think we couldn't separate the human health from animal health, the planet health. It's like really integrated. So I think like the climate change, the problem of air pollution, that I think at the moment in Thailand is experience a lot of problem of air pollution as well. We start to experiencing the really heat of the climate change. It's totally heated over the past summer, and of course this also impact mainly the vulnerable populations, especially the children and the elderly. So I think now also a lot of problem of the NCD. You just have to be very mindful eating, very careful that the dish in front of you is made up of a lot of good resource from the Mother Earth, something like that. So I have to be very conscious about not consumption too much, like just I think that's really important, that if we can put this concept to our young medical student, that they can continue to enhance and embrace this concept to the patient or the people around, is really important. Thank you.
Very nice, Dr. Tanini. I think this is something that perhaps all the Eastern cultures have in common regarding our traditional wisdom of incorporating, all the other human beings, the society, the family, the nature, considering all of that when we consider health. So somehow for us, all of us, it is a given that we have perhaps grown up with, but then had to revert to the conditions that we have learned in our medical colleges, not necessarily for the better, obviously. But I think there is still room for moving back to the roots which are worth keeping. And it is a fact that perhaps all traditions may not be in keeping with the times. But if we could look at some of our traditional wisdom, some of the practices that have been in place, we could reevaluate them. I would say, why not do more research on some of these practices, see the goodness in them, and keep the ones that seem worth keeping, and we can, leave the ones that don't seem so useful in the current times. But certainly, rather than just negate many of them, which is happening today in our often in our modern medicine, perhaps we can have a revival of some of these, because there are many instances. I mean, I can recall when I was doing my training, some of the facts that came up, I was amazed at the similarities that are there in tradition, which did not come from our modern medicine background. For instance, traditionally in India, women who go through deliveries are asked to take rest for about 40 days. And when I was doing my medicine, I was quite amazed to notice that it takes the uterus approximately 6 weeks to recover after the childbirth, and especially cesareans and all. And so it was, to me, it was it was like a revelation that we have already been following some of these things without really knowing the truth behind it. Similarly, when I came across this congenital hip dislocation in the US, there was at that time many instances of this. And one of the braces that they used for keeping the child, get back the hip in place, that was about keeping the thighs apart. And I was thinking how in our traditional practices, many of the women used to hold their children on the side. And so this it brought home the fact that people back then knew what they were doing. They didn't have modern medicine supporting it, but they did know many things. And I think such many practices are there. And there is a wealth of information there. There is a wealth of knowledge, I should say, that needs to be tapped. So at least if we, those of us who are in mainstream medicine, if we could bring about some change in terms of a revival of some of these practices, then through research, there could be more acceptance for it, is how I see it. So very nice to get all of your views, and it makes me feel that we are, many of us who think along those lines, and perhaps we need to get together and do something more about this than what is happening today. So that's a very positive outlook that I feel that comes out of this. So when we talk of a holistic perspective as a possible solution to address many of the concerns that we have raised, how far do you think this holistic approach could help in many of the concerns that we had. We talked about the financial burden. We talked about the mind-body connection. We talked about this, responsibility, having more of community-oriented programs. So all of this, do you think with the holistic perspective, many of these issues can get resolved? Dr. Satyanarayana?
Yeah, that's really the time. Now is the time to bring in the self and consciousness and the holistic perspective. See, if you see two things are there, one is the consciousness coming to the central role, and second thing is we are not the isolated entities like human beings. We are the part of the family, part of the society, as well as part of the nature. If you understand these two things, we can find out the root cause of the disease, because the consciousness, if we understand that, then we can find the root cause of the disease. So healthcare costs can be reduced. Second thing is, if we are not isolated entities, we are part of a larger whole, then the psychiatric problems and psychological problems may disappear. Because this cause of the stress is the feeling of isolated feeling. There's a cause of the stress in the society,
Yes.
as well as in the family, as well as the nature. I mean, not the nature, of course, in the individual. So all this spreads. And then second thing is, if you bring in the self, the concept, the harmony can be established in the self. Then body also will function in harmony. Self-regulation happens, as well as if the person is happy inside, it will spread happiness only. Harmony only will happen to in the family, in the society. So the current situation of the society is, we feel like it's a battlefield and crowd, because there is lack of understanding. The right understanding can be born from the self only, not from the body alone. So this is my input. So the vision is holistic. So that will definitely bring the change. And now is the right time to bring in these concepts. Thank you.
Very nice, Dr. Satyanarayanji. The proposal regarding understanding the self and its role in the program of health is a clear and possible solution for better health and reduced burden on society. And a whopping 91% of people strongly agree, those who are watching and listening in. So again, resounding words that seem to be, coming from people's own opinions, their hearts. Rita ji, if I may ask you, in your experience with these people with mental illness, mental sickness, what are your thoughts on their requirements for extensive care in hospitals? Because I am assuming that you would be taking care of those people who are able to take care of some part within them. And do you think that if this need is addressed early, perhaps we could be avoiding the hospitalization and extensive care required for many patients with serious mental illness?
So my experience has been that high expressed emotions in the family can trigger relapses where hospitalization comes into the picture. And it is usually, the family and the person living with mental illness are basically both very stressed out. One of the reasons is, there's not enough awareness of mental illness. The other is somewhere, the person goes missing. People start seeing them as, if a person is genuinely angry about something, it is always seen as a symptom. And it is, immediately doctors might be approached that the person's symptoms are going up. But the fact is, there might be a genuine reason for the person's anger, which is not addressed. So, in my experience, most of the time, it is lack of, listening to the person, lack of meaningful conversations with the person. In fact, in the family self-help groups, we always have this, at least a 5 to 10 minute session where two people face each other and they have to hear each other's story. There are certain questions put to them, and the other person is supposed to repeat the partner's story. And this is trying to impress upon people the importance of listening to others deeply and to also to expressing yourself clearly, and if you know your feelings and everything clearly to the other person. So the idea is that if the relationship improves, if there is an understanding of each other, there is nothing like a caregiver, which is a very popular term used in mental health circles. There is, you know, if I'm unwell, then you take care of me. If you are unwell, I take care of you. People with mental illness can take care of other people. They're well capable of doing it. So, you know, they're not silent. They don't even need to be silent recipients of care. So in most cases, and we've seen that, you know, with a good environment, with the right kind of inputs, a lot of crises can be stopped, because we see the changes in families where crisis was happening frequently. And then, you know, people started becoming more and more aware about what are the myths, what are the symptoms of mental illness, what, you know, how to communicate with people, the talk about trust and respect. And these kind of discussions happen on all fronts. They happen with the people with mental illness, they happen with families, they happen with staff. So the idea is, you know, somewhere the oneness is important, that everybody needs to understand these things. And then there can be a more equal relationship. And when the emotional outbursts are not, you know, too many, then less relapses happen. And people have learned that if the person with mental illness who has less control over their emotions and feelings, if they are given the space that when they are getting angry or when they're getting out of control, we postpone a dialogue and, you know, tell them that, you know, at this point of time, it's not really going to help you or me. Let's talk about this later. I understand that you have a concern, but let's talk about this later. Simple things like this can, you know, prevent hospitalization in a city for, you know, middle class runs into lakhs of rupees.
Yes.
And most states, even now, even a place like Gurgaon does not have any beds in this, you know, civil hospital for people with mental illness. There are a few beds for people with addictions, but nothing for people with severe mental illness, which means they also either have to go all the way to Rohtak from here, or you know, go to the private sector, which for them is criminal. It's almost impossible. And the trauma of injecting somebody, getting them into a van and getting them to the hospital is something that takes away the trust from the family for life. It is so traumatizing. And somehow, but families get desperate and they do it. It's not that they're bad people. It's just that they don't know how to deal with the situation. So,
Yeah.
yeah.
I can see that it's a very sorry state when we are creating so much trauma in a family that is already traumatized with so much of illness. And somehow we look at physical deformity, physical illness in a different way from mental illness in many ways. And again, I come back to your statement that we have to look at the person within, to treat them with respect, to give them the space for them to highlight their strengths. And perhaps we will not need so much of extended care in hospitals then. And that can cut down financially also a very large part of the burden on society. So thank you for your inputs on that. And I'm coming back to what was being mentioned regarding the community care. That communities, if they take charge of many of such conditions where we are not reaching the break point, then it can certainly reduce the load on the medical society as well as healthcare in general, hospitalization and so on, the burden on society. True. We can also have, Aparajita ji, any questions from others? Do we have time to take some questions? Aparajita ji, do we have any questions from people listening in?
See, Didi, we have around 6 minutes
Let
to
me
go.
see.
There are some hand raise also, Didi. Would you want to pass on the mic to the attendees, Didi?
Yeah, if you can probably hand the mic to somebody and the raised hand, and then we can take their question.
Namaste. Am I audible?
Yes, please, you're audible. Could you mention your name?
My name is Dr. H. N. Chandrakala from KT Tiptur, ma'am. My question
nice.
is, you are addressing that mental health of the people. I want a little bit more information regarding that mental illness in the child, because as a parent and a teacher, we are failure somewhere to recognize that problem in the child, because when we are getting that knowledge what happening inside, we can express, but the child, it cannot be expressed, and somewhere the parents also having a lack of knowledge to recognize that child have some issues regarding that mental health. So in this regard, if you put some more light, it is very helpful for others and all, I hope.
Did you want to address your question to anybody in particular?
Rita, ma'am.
Yes, Rita ji, would you like to answer that?
Yes. So I've been talking mostly of mental illness that generally surfaces when a child is about, let's say, in their late teens or older. And it can also happen, of course, later in life. The things that, should basically ring a bell is that people start avoiding others. They start living in isolation. Their behavior is impacted because the illness, the chemical change impacts your thoughts and feelings. So they start losing the confidence of being in groups. And even within the family, they'll try to stay by themselves, try to be in a separate space rather than be part of the family. You may see hygiene issues. You may feel that they are not taking care of their hygiene, but it becomes really difficult for them to take care of their hygiene. Also because they don't see any goals in life. They start feeling that they are not fitting into their family, or they're not fitting into society anymore. And of course, if it is when, there might be prolonged periods of sadness, there might be mood swings. And if this kind of a thing persists for more than, let's say, 2 weeks, and is to an extent where it starts impacting day-to-day life, you're not able to carry on with your day-to-day life, or your or day-to-day stressors, which all of us go through sadness, and all of us experience stress, but we are able to manage it, we come out of it. But if somebody is not able to come out of it, then that should be a trigger in our mind that the person, we need to talk to somebody. So yeah, it could be the physician to begin with, because if you catch this early, then a lot can be prevented. But of course, there might be cases, people where you might come across hallucinations. People are seeing things or smelling things, or hearing things that you and I cannot see or hear. That is more towards a later stage. And you get the feeling that they're completely cut off from reality. So those kind of things, delusions, बहुत वहम हो जाते हैं, they basically they become suspicious about their own family members and a whole lot of people. So these are the kind of things I think that if you notice, it's better to talk to a doctor.
Thank you, ma'am.
Yeah.
Ma'am, shall I ask one more question?
Aparajita
Didi,
ji,
we
do we
have
the time?
yeah, we have a minute to go only, Didi, and we have some more hand raise. What do you say?
Thank you. Thank you so much.
Thank you, Chandrakala ji. I think we may not be able to take another question, but what you mentioned, Rita ji, sort of brings home this point that you don't necessarily need a medical doctor to be able to figure out these issues.
Yeah,
Like you don't have a medical degree in your background, but I can see that you have done so much extensive work and you are able to figure out the issues with such people. And I think the acceptance part, the community effort, all of that makes a huge difference, I think. And we are almost at closing point, but I think tomorrow we can discuss how we can implement, since we are all mostly in agreement that these are some of the things that we need to bring about, how we can implement some of these. And I know that you will be there tomorrow also, Ritaji. So we'll get your insights into how your work, how it was brought about, how you got into it, and where you started from, your journey. If we can have some more inputs about that maybe tomorrow, and see how we can implement all of these in our work field, in the society where we are, at wherever we are standing now. So I think that we are out of time, and I would like to thank all our panelists. That thank you so much for your time and for being with us, and it has enriched our discussion a whole lot. And we look forward to your active participation tomorrow also. So all the very best of wishes. Thank you, everyone.
Thank you. Thank you so much.
Thank
Thank
you.
you so much.
Thank you. Namaste.
Thank you, everyone.
Namaste.
Namaste.
Namaste.